The IAU SDG3 cluster is pleased to be holding its first 3-day in-person member workshop at the Universitat Oberta de Catalunya in Barcelona, entitled Collaboration for an Integrated Approach to Health in Support of Equity and Wellbeing Worldwide. Over the 3 days, we will be exploring how health is being redefined in universities, what this looks like in practice, and enabling factors and challenges around collaboration in health. We will also look at how members and universities are currently incorporating SDG3 and the SDGs in their institutions. The IAU SDG3 cluster is comprised of 7 higher education institutions across 5 continents, including West Sydney University in Australia, Makerere in Uganda, Universidad de Caldas in Colombia, Universitas Gadjah Mada in Indonesia, Karolinska Institutet in Sweden, College Dublin in Ireland, and the Universitat Oberta de Catalunya in Catalonia. The SDG3 cluster works towards promoting an integrated approach to health in support of equity and well-being worldwide. What do we mean by an integrated approach to health in support of equity and well-being worldwide?
In order to achieve health and well-being for all, the most important thing is to have the patient or the citizen in the center of the interventions. And this citizen and this patient is somebody having maybe not enough resources, being in a vulnerable area or under vulnerable conditions.
To me, integrated approach to health means collaboration. Collaboration between and among healthcare providers, the community, and individuals to really ensure the physical, mental, and social well-being of everyone.
Health is a complex problem that is affected by multiple factors, such as the environment and then education, social problems. So when we look at how to tackle health, we actually have to collaborate with many stakeholders and to integrate together to find different ways to provide the solution for that.
Health equality is important for a variety of reasons. It helps with global economic growth, it helps with sustainability, it helps with human dignity and social justice. Unfortunately, human health is not equally distributed, or human healthcare is not equally distributed. Programs like the Sustainable Development Goal are crucial to addressing those disparities so that we have quality healthcare available to all.
Para nosotros, la salud integral es aquella salud que busca el bienestar físico, el bienestar mental y el bienestar social, pero muy encaminado hacia el logro de la calidad de vida de las poblaciones. Por eso tratamos de desarrollar un trabajo interdisciplinario, interinstitucional e intersectorial.
Desde la docencia, la investigación y la proyección aportamos para la construcción de un concepto integral de salud, pensando siempre llevar el bienestar a las comunidades y aportar en ese gran logro.
Learning about each other's activities and making these global connections is vital for our joint efforts and our joint vision towards a more sustainable future.
Discover our key learnings of 3 very rich days of connection and knowledge sharing here.